Hello everyone, this is Shami from Doctor Story. COVID-19 pandemic has changed pretty much everything in the world. Our lifestyle, our entertainment, our social interaction, our fashion and whatnot. However, life goes on. Every day we hear about so many people are getting diagnosed with COVID, and unfortunately, so many people has lost their lives and still losing their lives due to this situation. And parents have all the reasons in the world to be worried about their children's well-being. And as you already know, Doctor Story covers the most important factors of human health with experts from across the globe. And today we have invited Dr. Deepa Easow, Senior Consultant Pediatrics and Neonatology. She has over 15 years of experience managing sick children and newborns. Her field of interest is the growth and nutrition of children. She is also an alumna of the Institute of Child Health and Hospital for Children. She has gained vast experience over the years managing the various conditions that affect children. Dr. Deepa Easow, a warm welcome to Doctor Story's virtual studio.
Thank you. Thank you for having me on Doctor Story. I'm doing very well, thank you.
So how are you? How is life in general? And how is life as a doctor in this ongoing pandemic?
Luckily, we haven't been seeing too many children affected with COVID. Especially during the first wave, we didn't have too many children affected. Most of them who were affected were mildly symptomatic or they were asymptomatic. So most of them, we were able to manage them at home. Similarly, now with the second wave, of course, the numbers have increased a little bit. But even then, we don't find children who are very sick. So because of that, we are not having to put in too many hours, taking care of very sick children, which is a blessing. But of course, I think the way our schedule has changed is we don't see too many children coming for their routine checkups and for the routine vaccinations and things like that. That is what we used to do a lot, as a general pediatrician, I used to see a lot of children coming for their routine stuff. Nowadays, you find parents are not coming for that. They're too scared to bring their children to the hospital. So most of the time, we end up doing a lot of teleconsultations. And the problem with teleconsultations is we don't have a time frame for it. It can be any time. Parents are panicking when either their children develop a symptom or when their children are tested positive. So most of the time, we end up having to counsel them, reassure them, that this is not going to become a problem for their child, that their child will get better, things like that. So, of course, that is a big difference that I've seen in my practice. And the other thing is, of course, taking the precautions. So every patient we see could be a potential COVID infected patient. So we have to take precautions, so we have to kind of gear up. We are on an N95 mask with a shield all the time. If it's 8 hours in the hospital throughout, we are masked. So we try not to take off the mask even to get a drink of coffee or tea. And if we are going in to see a suspect COVID patient, we put on the full PPE, which is not easy, wearing that and doing procedures and things like that. And especially for long duration when we have to wear things like that. These are things that we are not used to. And even when we go to attend a delivery, we have to gear up. We have to gear up, we have to wear all this and go in and attend a delivery. So that's very, very different. And the most difficult thing that we find is we are unable to kind of communicate with the children. The children like to see their doctors' faces. They like to see doctors smiling at them, communicating with them. Our faces are all masked and, we have a shield covering. So we are unable to and I think, when they see a doctor like that, children do get scared. So it becomes a lot more difficult for us to be able to communicate and strike up a rapport with the children that we face.
So I have a couple of questions for you. And my first question will be, why the second wave is affecting kids way more than adults?
Yes, we are seeing more children affected. But as I said, it still isn't an alarming number. This wave, we are seeing more adults affected. So when you see more adults affected, automatically you see more children also affected because children are getting infected from adults. So that is one reason why we are seeing more children being affected. The other reason is we have a mutant strain right now in India. And this is a mutant strain which is probably more transmissible and more infectious. So that is another reason why we are seeing more children being affected. So if you see, it will be the whole family affected. It's not the child alone that's getting affected. The adults in the family get affected, and that is being transmitted to the children. So definitely we are seeing that. The major difference that we are seeing between the first wave and the second wave is, in the first wave, most of the children were asymptomatic or mildly symptomatic. This time around, most of the children we are seeing are symptomatic. They are usually having a fever, and more than respiratory symptoms, we are seeing them more with gastrointestinal symptoms. For example, they have a diarrhea, vomiting, and many of them are coming dehydrated to the hospital. So that is a difference that we are seeing in the second wave. Now, coming to a third wave, yes, a third wave, which is going to affect children more, is being predicted, but there isn't anything much to kind of any data to prove that that is going to happen, because we still feel that children have got a protection from the SARS-CoV-2 virus because of the receptors. There are certain receptors in our nose and in our respiratory tract known as ACE2 receptors, which are needed for the virus to attach itself to. And the ACE2 receptors are definitely lower in number in children. And that is a hypothesis that is put forward to say that children are not getting affected as much as adults are. So we still believe that unless and until the virus undergoes a drastic mutation, we are not going to see a more severe illness in children. The numbers might be more, but we still will not see a very severe illness in the children. The other reason why a third wave might cause an increase in the number of children affected is children are the category that don't have a vaccine at the moment. Especially in India, children still do not have a vaccine, whereas all adults, are either getting at least one dose of the vaccine. Many of them have got 2 doses, and we are, kind of trying to get all adult population vaccinated. Whereas in children, we still have a long way to go to get a vaccine. Though other countries have started vaccinating children above the age of 12 years, India, we still do not have enough data to start doing that. The vaccines available in India have still not been authorized for use in children. So the fact that children are going to be a vulnerable population because they are not vaccinated might increase the numbers.
So my next question will be, what do we have to do to take care of our kids?
See, prevention is always better, than cure. So children are getting infected from adults. So what should adults do? Adults should follow the WHO protocols by hand sanitization, masking, social distancing. Don't go out unless and until you have to. And of course, vaccinations. So if we try to prevent infections in adults, automatically we will be protecting the children at home. So that is the best way to prevent an infection in an adult. Now, supposing a parent is tested positive at home, what they need to do is they need to mask up. They need to mask up. They need to keep sanitizing their hands, and they should isolate themselves. See, it's difficult to isolate a child, who's aged 3 years or 4 years. You can't put that child into a room and say, no, you don't come out because I've got COVID, because that's not the way children are. So it's easier for the adults to isolate themselves. If they are showing symptoms, they should isolate themselves in a room, wear a mask. And if it is a child above the age of 2 years, that child should be advised to start wearing a mask. So children should be taught. It shouldn't be done as all of a sudden. Or even now, you should start training your children to start masking up. So the way you do that is try to make the mask as less intimidating as possible. So you try to make a children-friendly mask. Who is your child's favorite cartoon character? So you try to make a mask and you draw the cartoon character on the mask, and then you put the mask on your child's favorite toy or doll. And you say, see, your doll is masking up. See, she's fine, or your teddy is masking up. So this is not something frightening. And so then you start making the child wear it, so that the child gets used to this concept that this is not something that is going to scare me. It's not going to choke me. It's not going to suffocate me. So the fear of the mask goes. And the other thing is encouraging children to wash their hands. Now, it's difficult to kind of tell them, you wash your hands for 2 minutes or 20 seconds. So the best way to do that is you tell the child, sing happy birthday twice. And that would be the time that would be required to sanitize their hands. So try to make, the precautions that a child has to take, try to make it as child-friendly as possible, so that the child is not scared of doing all of these things, but the child starts enjoying doing this, and it slowly becomes a routine. So things like this will help in preventing the child from getting an infection, especially when the child goes out of the house. I mean, try as much not to take the child out of the house, but if at all, if the child has to go out of the house, the child should be masked and the child should come back and do things like this. And even in the house, the child should be trained to do things like this, so that in supposing an adult in the house gets positive also, the child knows that these are the precautions that I need to take, and the adult does it. So parents are role models. Children tend to, copy what the parent is doing. So if the parent is doing this regularly, then the child automatically starts doing this. So these are some of the ways by which we can keep our children safe. And adults definitely should be encouraged to go ahead and get the vaccinations. Whatever the vaccination available in your country is, just go ahead and take it. So much of data coming on social media these days about different vaccines, but I don't think this is a time where we can choose. I think the important perspective is just go and get the vaccine. No matter what it is, just go and get the vaccine. And that is the best way to protect your child.
My next question would be, do you have any tips for special need children?
Special need children are a category of children who have been very badly affected because of this pandemic, because they're so used to a routine, a structure in their lifestyle, and things like that, which have all just gone completely berserk during this pandemic. So the important thing that needs to be done is we need to continue to give them a routine, continue to give them a structured routine, in their day-to-day life. Children who are going to schools, who have not been able to go to schools, should have some kind of a routine in their homes. You make them get up in the morning, make them have breakfast, whatever time they're used to having breakfast, and then have a routine where they do a bit of study, then they have a playtime, then they should be given opportunities where they can communicate with their friends. So allow them to make a WhatsApp call or make a video call with their grandparents, with their relatives, with their friends, so that they are in touch with other people. They are in touch with their routine. That's what I mean. So it is important that that routine is tried to be maintained for children like this. The other thing is all their appointments with their regular doctors, be it a psychologist, be it a pediatrician, be it an occupational therapist, be it a physiotherapist, that should continue in some way or the other. If they are unable to go and physically meet with them because of the lockdown, then they should be encouraged to at least be in touch with these people, at least by video consultations, so that the treatment goes on. There isn't a break in the treatment. Because when there is a break in the treatment, these children tend to react very badly to it, and it will become very difficult for parents to handle them. And it is important that their emotional and their mental health is taken care of. So this doesn't go only with special need children, it goes for all children. All children, because they have been away from schools, for the past 1.5 years, and life hasn't been the same. They don't go out and play. They don't go out and play with their friends, which was a stress buster for them. So we need to try and create that kind of an atmosphere as much as possible at home, and not just allow them to do what they want. Get up at whatever time they want, eat at whatever time they want, and just use screen time at whatever time they want, and things like that, because that is really going to land these children in a lot of problems. So it's important to maintain a structured routine for these children and also keep in touch with their therapy givers.
My next question would be, as we already discussed, about the increase of immunity. So what we can do to increase the immunity of our children?
Social distancing, avoid crowding, avoid crowded areas, try not to go out at all, unless and until it's an absolute must. So that is the way, because the only way this disease is transmitted is from human to human. So, I mean, this is one a disease where we need to keep away from other human beings. Man is a social being, and we love to be, to socialize and things like that. And children all the more, they love to be with their friends. But this is one time when we shouldn't, even if it is, people living in apartments, we shouldn't allow children to go to the common play area or play with your next door neighbor, because you do not know whether your next door neighbor is infected. So children have to be kept, separate, and you don't go out unless and until it is an absolute necessity. So that is extremely important. And the other way is, of course, take care of the child's general health. Give the child good, nutritious food. Don't allow them to be binging on junk food, because we see that obese children have a more severe course of the illness. And I have had so many of my patients, who have been doing video consultations with me. And over the last 1.5 years, they've just gained weight. All of them have just put on so much of weight, and if you chart their BMI, they all fall either in the overweight or in the obesity category, which is not good, because that is going to pose a lot of other health problems for these children. So children should be given a good, nutritious, healthy diet, avoid junk food. They should have some kind of an exercise routine that they can do within the confines of their house, something that the whole family can do, so that everybody enjoys it, So, and then of course, take care of their mental health, because depression and stress reduces immunity. So keep their mental health good. And the only way that you can keep their mental health good is avoid screen time, avoid TV time. The whole family shouldn't be sitting and binging on television news, because you hear all the negative news on television. Of course, you need to know what's happening in the world, but 24 hours, if this is what is going in, children are going to be scared. Children are going to wonder what is going to happen, what will happen to me, what will happen to my parents, So that is going to cause a lot of problems, because we are seeing children with a lot of mental health issues. They are unable to say that it is mental health issues, but then they come complaining of all kinds of other complaints, vague complaints that we can't figure out what it is. And then ultimately, when we kind of probe the child, we realize that underlying it is the fear of the disease and fear of something happening to them or to their parent. So it's important that the mental health of the family should be taken care of the child especially should be taken care of. And this should be a time when parents bond with their children, have good family time, have a game together, play caroms together, have a story time together, or, and keep in touch with the rest of the family members, either by a WhatsApp call or a video call, let them be in touch with their grandparents, with their cousins. So all of this tends to improve their mental health. And these are all ways by which we can improve the general immunity of the children.
I have a very general question, but I believe it's also very important. Correct me if I'm wrong. What we can do to be careful? People are being careful anyway, but do you have any special tips to be careful for?
Understand the concern, especially in certain countries, even in India, it's difficult, social distancing is easier said than done. The important thing is don't take vulnerable people to the store if you have to go to the store. For example, don't take your child along to the store, and don't take people, the elderly, who are again a high-risk group of people, and people who have got multiple comorbidities, like hypertension and diabetes. So don't take people like that and go to the store. And the most important thing that you can do is masking, because masking definitely does prevent, because the only way the virus gains access into your body is through your mouth and through your nose. So it's important that we keep the mouth and the nose covered. So either wear an N95 mask. Everybody might not be very comfortable wearing an N95 mask. Now the WHO recommends double masking. So you wear a cloth mask inside, and then you wear a surgical mask, a 3-layered mask outside. So when you are double masking, it does give a lot of protection. And it's important that when you go into the store, you see a particular person there without a mask. I think it's important for every one of us to politely tell the other person that they should also wear a mask, not only to protect themselves, but to protect us. So I think all of us do this. I think this awareness of masking will definitely increase and people will start wearing a mask. And then, as you said, definitely hand sanitization is important. When you get back from the store, it's important that you do sanitize your hands and, make sure that only after that you touch things in the house. So that definitely will prevent the disease to a great extent. And as I said, regarding increasing immunity of children, we find children being loaded with multivitamins and vitamin D and zinc and vitamin C and all that. As I said, just a normal, healthy diet, is more than enough for the child to have a good immunity, a good, a mental state of mind is more than enough, because as I said, stress tends to decrease immunity. So make the child be happy, not have so much of fear and stress, and take care of, if the child develops any symptoms, take care of it the way that you would take care of any other illness. For example, a child has a running nose. Don't panic and go and immediately, go and buy some over-the-counter antibiotics and dose the child on that, because you're not increasing the child's immunity by doing things like that. So instead of doing things like that, the important thing is, if you are worried, you need to contact your pediatrician, at least by teleconsultation, talk to them and go by what they are going to advise you. So of course, vitamin C and zinc have been recommended. It's okay to take that, at least it's not harmful. But we find people taking all other kinds of drugs saying that it improves the immunity, and there is no data to prove that. So all that we advise in children is maintain a good weight. Don't be binging on junk food and increase, because as I said, obese children tend to have poorer outcomes and they tend to develop a lot of comorbidities. So have a healthy diet, sleep well. That's extremely important. Many of these children, their sleep pattern is completely disrupted because they are so much of screen time. So we say 1 hour before bedtime, all screen should be closed. Whether it is a mobile phone, whether it's an iPad, whether it's a television, everything, because the light emanating from this tends to disrupt the sleep cycle. So we say 1 hour before it, everything should be switched off. The child should go to bed at the same time every day, should get up at the same time every day, and give the child something to do at home. If you can't play a game, if there is no space, at least make the child help you to do a little household work. Small things a child can be encouraged to do. So things like this, what happens when the child is physically active, what happens is that it will help in reducing the weight, keeping a good weight, and also the child gets tired, so the child will sleep better. The child will get his mind off COVID and all of its complications. So all of this, I think, helps in maintaining the immunity of the child. So a good diet, good sleep, good mental health, all of this, I think, plays a very important role in maintaining the immunity of the child.
So my next question would be, which are the children who are at high risk for COVID-19?
That's a good question, yeah. So what we are seeing during the second wave is that children who are obese, as I've been continuously saying, children who are obese tend to have poorer outcomes. We are finding them landing up with COVID pneumonia, with breathing difficulties and things like that. So obesity definitely would come as a high risk in COVID. The other conditions are a child who has got a problem in the kidney, who is on long-term medications for that. Children who are on immunosuppressants for some reason, for some condition that they have. A child who has got a cardiac issue, a child who has got a lung problem, a child who has got immunodeficiencies. So these are the children who usually we say are in the high risk group. The other category is children who are less than 1 year, newborns less than 1 month, and generally children less than 1 year. We are a little bit more careful with them because they also fall into the high risk category. So these are the children that we usually say that if they develop a symptom or if they are tested positive, then it's better that they immediately consult with their pediatrician. And based on their symptoms, then we decide whether to admit them and keep them under observation in a hospital, or they are okay enough for us to be able to do teleconsultations and monitor them. So these children will require special monitoring.
Thank you so much, doctor, for sharing your knowledge with us. We are almost at the end of the discussion, but I still have one more question. Uh, any treatment parents can do from home? As you know that hospitals are overwhelmed, there is no bed, and it's difficult for people to find a bed for any treatment in this second wave. So can you give us any tips so parents can do from home?
See, children who are tested positive with COVID, as I said, most of them, the time it's mild symptoms. Most of them have a fever. And we recommend that parents give paracetamol at home. Most parents will have paracetamol at home, if they have been to a pediatrician before. So we say, bring the temperature down by giving paracetamol. If the temperature is still very high, we say, wipe the child down, do something known as tepid sponging. That is, wipe the child down with tap water so that the temperature comes down, especially children less than 5 years, So we don't want them to, the temperature going very high and for them to throw a convulsion. So we say, wipe them down so that the temperature comes down. The other thing is keep them well hydrated. Children at this time will usually refuse to eat. So instead of forcing them to eat, at least make them take plenty of liquids, keep them well hydrated. So that, because most of the time we see children coming in looking very dehydrated, and that is one of the reasons why we have to admit them. So we want parents to prevent that. So the moment you find that a child is running a temperature, these children require extra amount of fluids. So whatever fluids, even if it is plain water, if it is an electrolyte solution, parents can give that. They can keep giving sips of that so that the child is kept well hydrated. So other than that, we do not expect the parent to do anything else. Start antibiotics, go and get a CT scan done, go and get a whole load of blood tests done. We are finding parents do that because they feel, that's what's happening to adults. So the moment an adult is tested positive, immediately the adult goes and the doctor asks for a CT scan and a whole load of blood tests. So parents feel that the moment the child is tested positive or even showing a mild symptom like fever, we find parents running to the CT scan center and getting CTs done. A CT has got a lot of radiation. Of course, we have image-friendly techniques now where the radiation is much less, but it still is radiation. Why would we subject a child to that kind of a radiation when it's not needed? So all that we want parents to do is wait for up to, if the child is otherwise active, when the fever comes down, if the child is playing around, smiling, and normal when the child is afebrile, the child is taking enough liquids, we usually say you can wait up to 3 days. Now, if the fever is persisting beyond 3 days, or the child is not taking anything at all, the child is vomiting, the child is having very severe loose motion, that is an indication that you need to contact your pediatrician much earlier. So other than that, we just say, keep the child at home, give paracetamol, hydrate the child, just monitor the child. Is a child passing enough urine? Is a child drinking enough? Is a child breathing normally? Is a child otherwise active? If all of this is going on, that means your child is doing well. There is no need to panic. If any of these, we say warning signs. Warning signs is a child that is lying down all the time. Even when the child is not running a temperature, the child is just curled up in bed. The child is not eating anything, has not passed urine for a couple of hours, is breathing very rapidly, or is making a noise when the child is breathing. These are all the warning signs that we say. So if any of this is happening to your child, that is an indication that you need to contact your pediatrician immediately or take the child to the hospital immediately.
Based on the suggestions you have just shared, I have one last question. You suggested that the child need to be hydrated well. What is an ideal amount of liquid or fluid a child should intake on a regular basis?
That is very different based on the age. See, children is right up from newborn, right up to 18, we call them children. So it's extremely different. The one way by which you will know whether you are hydrating the child well is monitoring the urine output. If a child is passing plenty of urine and the urine is not high colored, then that means the child is getting enough liquids. Now, if the child doesn't pass urine for about 6 hours, and when the child passes urine, it is high colored urine, very concentrated high colored urine, that is an indication, that is a warning sign that this child is not getting enough liquids. So that is an indication that you need to increase the amount of fluids that the child is going to have to take in.
Thank you so much, Dr. Deepa Easow. It was a productive conversation with you. I firmly believe our audience will greatly benefit from your valuable tips. Thank you everyone for tuning in with us. If you want to stay healthy and looking forward to easy and inexpensive tips, then feel free to check out our videos. Don't forget to like, share, and subscribe to our channel. See you.